You're standing over someone who's bleeding out. There's a rock in your hand. You have never seen a doctor because doctors don't exist yet. There's no such thing as a medical degree, a hospital, a textbook, or even the word surgery. And yet somehow, in the next 10 minutes, you're going to open this person's skull, remove a piece of bone the size of a coin, and they're going to walk away from it. Not die from it. Walk away from it. This actually happened. Thousands of times, in fact, across thousands of years, on nearly every continent on Earth. And the people doing it had never read a single page about anatomy, had no concept of germs, had no anesthesia beyond maybe a strong drink or a hard blow to the head, and somehow got good enough at it that we can still find their patient skulls today with the bone healed cleanly around the hole. So who were these people? What were they thinking? And how does someone become a surgeon in a world that has no idea surgery is even a category of thing a person can do? Here's the twist nobody expects going into this. These weren't doctors in any sense we'd recognize. There was no accreditation, no apprenticeship program, no guild of certified bone cutters wandering the tundra. In most cases, we genuinely don't know who these people were. We don't have their names. We don't know if they were healers, hunters, elders, or just the one unlucky person in the group who happened to be steady-handed the day someone got their skull cracked open by a falling rock. The Stone Age surgeon, as fascinating as that phrase sounds, may not have been a specialist at all. They may have been improvising. And that's the part of this story that should genuinely unsettle you a little, because it means an enormous amount of what we now consider sophisticated medicine may have started as somebody just trying something and getting lucky enough times in a row that it became tradition. Let's start with the procedure that keeps showing up in the archaeological record more than any other, because it's the one that sounds the most impossible. Trepanation. Drilling, scraping, or cutting a hole directly into a living human skull. We have evidence of this going back over 9,000 years, on every inhabited continent except Antarctica, performed with nothing but stone tools. And here's the detail that should stop you in your tracks. A huge number of these skulls show clear signs of bone regrowth around the opening. Smooth, rounded edges instead of jagged fresh breaks. That's not a wound. That's a healed wound. That means the patient didn't die on the table. They lived long enough afterward for their own body to start repairing the hole in their head. Some skulls found by archaeologists show multiple trepanation sites. Not one hole. 2. Sometimes 3. On the same person. Which means somebody survived this operation, went back to their normal life, and then at some later point, someone opened their skull again. And they survived that too. Whatever was happening here wasn't a one-time desperate gamble. It was something people kept doing, kept surviving, and apparently kept believing was worth doing again. So why would anyone do this in the first place? The honest answer is we don't fully know, and any single explanation is probably wrong because different cultures almost certainly had different reasons. Some skulls show trepanation near obvious skull fractures, which suggests they were treating traumatic head injuries, possibly relieving dangerous pressure from swelling or bleeding beneath the bone. That part actually lines up with real modern neurosurgery. Relieving intracranial pressure after a head injury is a legitimate, life-saving procedure today. Which means somewhere along the line, ancient people figured out through repeated trial and error that opening the skull could sometimes save a life that would otherwise have been lost. That is a genuinely staggering thing to have worked out with zero understanding of the brain, zero understanding of pressure, and zero understanding of anatomy in general. Other examples don't line up with any obvious injury at all, which points toward something less medical and more spiritual. Some researchers believe certain trepanations were performed to treat epilepsy, chronic headaches, or what we might now describe as mental illness, under the belief that something needed to be released from inside the head. Evil spirits, pressure, pain itself as a physical trapped thing. Ancient medicine and ancient religion weren't separate categories the way they are now. The line between physician and priest simply didn't exist yet. The same person cutting into your skull might have genuinely believed they were letting something out of you as much as taking something out of you. Now here's where this story gets almost darkly funny. Compare this to what was happening in actual hospitals thousands of years later. Effective antiseptic practice in Western medicine didn't become standard until the 1860s, when a surgeon named Joseph Lister figured out that maybe, just maybe, doctors should wash their hands and instruments before cutting people open. Before that, hospital mortality rates in the 1840s were sometimes worse than battlefield mortality rates, because hospitals were breeding grounds for infection in ways nobody understood yet. Which means a Stone Age trepanation, performed outdoors, in fresh air, with a freshly napped stone tool, may have accidentally had better sterility conditions than an operating theatre in Victorian London. The ancient surgeon working in open air by pure accident avoided the exact mistake that was still killing patients thousands of years later. Trepanation wasn't the only major procedure ancient people were quietly mastering. We also have direct skeletal evidence of amputations that healed. A skeleton discovered in France, dated to roughly 7,000 years ago, shows a forearm removed cleanly, with clear signs the bone had begun to regrow and remodel at the site afterward. That single detail tells us something enormous. This wasn't a lucky accident, like losing a limb in a fight and somehow not bleeding to death. This required a deliberate act, followed by an entire system of aftercare. Someone had to stop the bleeding. Someone had to keep the wound clean enough not to become fatally infected. Someone had to feed and support a person who could no longer hunt, gather, or fully care for themselves during recovery. That's not a lucky survival. That's a functioning support system built around one injured person, which tells us these communities had something resembling organized medical care embedded directly into how they lived. So how does someone develop the skill to do this with a rock? The answer is almost certainly the same process that produced every other piece of ancient medical knowledge. Relentless observation, repeated over generations, passed down through direct demonstration rather than written instruction. Someone tried something on someone who was already probably going to die anyway. Sometimes it failed. Often it probably failed. But every so often, it worked. And the people who watched it work remembered exactly what was done, exactly how it was done, and taught it to the next person who needed to know. Over dozens of generations, across an entire community's collective memory, a genuinely functional surgical tradition could emerge without a single person ever writing anything down, without a single formal lesson, purely through trial, error, and communal memory acting like an oral medical textbook. This is a critical thing to understand about how ancient knowledge worked in general. We tend to imagine progress as something that happens through individual genius. One brilliant person figuring something out in a flash of insight. But most ancient medical knowledge almost certainly accumulated the opposite way. Slowly, collectively, anonymously, built by hundreds of unnamed people making small adjustments across centuries, each one slightly improving on what came before without any of them realizing they were building something that would eventually be called a surgical tradition. The Stone Age surgeon wasn't one person. It was effectively an entire community's memory, distilled down into whoever happened to be holding the tool that day. And it wasn't only trepanation and amputation. Archaeological and anthropological evidence suggests ancient people were setting broken bones with splints made from wood and bark, using specific plants with genuine anti-inflammatory or antiseptic properties to treat wounds, and in some cases even attempting more delicate procedures like tooth extraction and dental repair. In Pakistan, archaeologists uncovered evidence of dental drilling dating back roughly 9,000 years, tiny precise holes bored into molars using flint drill bits, almost certainly to remove decayed material. Someone was doing dentistry with a rock spinning on a string thousands of years before anyone had ever heard the word cavity. What's genuinely remarkable is how consistent these discoveries are across completely unconnected populations. Trepanation shows up independently in ancient Peru, in Neolithic Europe, in parts of Africa, and among various groups across Asia, with no possible contact or shared knowledge between most of these regions. Which strongly suggests this wasn't one brilliant idea that spread. It was something multiple separate human populations arrived at independently, through the exact same process of watching injuries, trying interventions, and remembering what worked. When something that specific and that unlikely shows up again and again in populations that never met each other, it's a pretty strong signal that it wasn't a fluke. It was a genuinely reliable, repeatable, teachable body of knowledge, built from scratch, more than once, by people we will never know the names of. Now, before this starts sounding like ancient medicine was secretly just as good as modern medicine, it wasn't. Not remotely. For every skull that healed, there were almost certainly far more that didn't, and those patients simply don't survive in the archaeological record the same way, because a fresh unhealed wound looks a lot like an injury someone died from in some entirely different way. We're only seeing the successes. The failures are largely invisible to us, buried without the telltale signs of healing that make a case identifiable centuries later. Infection, blood loss, and shock almost certainly killed a significant number of people who underwent these procedures. This wasn't a polished medical system with a high success rate. It was closer to an enormous, uncontrolled, multi-generational experiment, where every single surviving skull represents someone who beat genuinely brutal odds. And there's something worth sitting with here. These accidental surgeons weren't operating with confidence in the way a modern doctor does, backed by decades of training and evidence. They were almost certainly working with a mixture of desperation, observation, and belief, in a world where death from infection, injury, or illness was a constant, immediate, everyday possibility rather than a distant statistic. Every single procedure was a genuine gamble, made by someone who had absolutely nothing resembling a safety net if it went wrong. So who gets credit for inventing surgery? The honest answer might be nobody. Or rather, everybody. Thousands of unnamed people across thousands of years and dozens of unconnected cultures, each independently stumbling toward the same basic realization: that the human body, broken and bleeding and swollen, could sometimes be fixed by deliberate, careful intervention rather than simply left to fate. Nobody woke up one morning and invented surgery the way we invented, say, the wheel. It emerged slowly, anonymously, out of pure necessity, built by people history will never name, refined by trial and by death, and somehow passed down carefully enough that we can still find the evidence of it written directly into bone, tens of thousands of years later. The next time you go in for a routine procedure, numbed, sterilized, monitored, and statistically almost guaranteed to go fine, it's worth remembering that the entire concept of intentionally cutting into a human body to save it started with someone standing over a dying person, holding a rock, and deciding to try anyway. No training. No certainty. No name that survived. Just observation, nerve, and an entire community quietly keeping track of what worked. That's not a footnote in the history of medicine. In a very real sense, that's the beginning of it.